Yes, children do suffer more with ear problems, specifically ear infections, and this can cause hearing loss. Um, Around half of 3-year-olds will suffer with hearing loss due to an ear, a middle ear problem with glue ear, which usually resolves as the child grows. And this is thought largely due to the maturing eustachian tube and middle ear, which as the child grows, they grow out of the problem for the vast majority. The main problems with balance caused by an ear problem is the symptom of vertigo. Vertigo is a symptom, it's not necessarily a diagnosis, and it's the sensation of the world moving either around you or moving while you're stationary. And it can be quite quite an unpleasant symptom, often associated with nausea and possibly vomiting, and people that suffer that feel really awful, and it can go on for seconds, it can go on for minutes, hours, or even days to weeks, caused by different conditions. But the main thing to be looking out for, the main symptom to be looking out for with an ear-related balance problem is the sensation of vertigo, or the world moving around you. People should see a doctor or an ear or ENT specialist with ear problems, really whenever they are struggling to get some resolution, I suppose. It's difficult to say, because some people with ear problems need to be seen urgently. If there's a sudden loss of hearing, for example, that is something that really should be seen the same day. If there is a problems with vertigo, then that again is something that people should seek medical attention. Symptoms of tinnitus, especially if it's just in one ear, should be seen by a medical specialist or an ENT specialist for an assessment. So I guess it's any symptom related to the ear that that you can't explain, or is worrying or troubling, but especially pain, hearing loss, tinnitus, imbalance, and vertigo are the symptoms that people should seek medical attention for. The aging process, I suppose, is the #1 cause of hearing loss and balance upset. And so as we all get older, certainly once you go past the age of the mid-40s and you start to require reading glasses, you can often detect some high frequency hearing loss just by nature of the aging process. And once you go past the age of the mid-60s and 70, many people will start to require hearing aids to treat that hearing loss. And eventually, if the hearing deteriorates either more rapidly due to a variety of conditions, then hearing implants may be necessary to help treat the hearing loss and improve the ability to communicate and use hearing. Well, it's important to stay fit and healthy, so maintaining a healthy lifestyle, a healthy diet, exercise, and all of those things that are going to help keep your body fit is going to be helpful in terms of keeping your balance in good shape, because a good core strength and a good peripheral nervous system is critical, along with good inner ear function to maintain balance. From a hearing perspective, again, things that are going to maintain a good healthy lifestyle, being aware of communication and using all the other cues that, along with hearing, to maintain good communication. So correcting visual loss so that you've got good eyesight. When communicating, looking at the person you're talking to, using the visual cues around lip reading and things like that, which is really essential for good communication. Are all those things that are helpful to keep your ears and hearing functioning well.